Patrick. How are you doing today?
Good, how are you?
Doing very well, thank you. So, what we're here today to do is to talk about the assessments that we did yesterday when you were in. Is
Okay.
that all right?
Yep.
Wonderful. So, before we do that, I just want to ask you a few other questions. Can you tell me a little bit about your home care and what you do to take care of your teeth?
All I do is brush once a day.
Oh,
That's all I do. I don't floss. I don't use fluoride rinse. I just brush once a day before bed.
okay. And what would you say your oral health is on a scale from 1 to 10?
I think it's great. I've never had a cavity. Never really had any problems with my teeth, so I
Okay.
think it's good.
So would you say like an 8 or a 9?
Yeah. Oh yeah.
Okay, that sounds wonderful. Um, so next I'm going to go over my assessments with you and
Okay.
kind of talk about how it goes along with how you are feeling about your teeth. So first, I noticed that there's some more red tissue. We really do like to see very pink tissue. But your tissue is mainly red.
Okay.
It also bleeds quite easily to the touch. During probing or instrumentation, we were seeing quite a bit of bleeding. And then there's also been an increase in your pocket depths. Um, and this means that between the tooth and, if this say is my pocket, um, the pocket is slowly coming down the tooth, so there's been a loss of attachment.
Okay.
And that means there's been a destruction of fibers, tissue, and in some areas it looks like there's actually been some destruction of bone. And we can look on the radiographs and see that as well, that the bone level has decreased over from what we would like to see it. So, with this new information, how does that make you feel about your oral health?
5, 6.
5, 6.
Yeah.
Okay, so it sounds like you're a little bit more like unsure about what's going on in your mouth.
Oh yeah.
Okay. Um, and what do you think has been causing this? What do you think is these increase of pocket depths are caused by?
Bacteria. I have no idea.
Bacteria? Okay. That is true. It is caused by bacteria. Is it all right if I explain the process to you?
Sure.
Okay, wonderful. So what's happening is there's definitely bacteria. We also, in our assessments, noticed that there was an increase in plaque levels. So there was quite a bit of sticky plaque that is
Okay.
attached to your teeth, and that holds the bacteria. And the bacteria, again, going back to my tooth and my gingiva here in the pocket, the bacteria is able to get into that gingival pocket, and from there it starts to produce toxins, and those toxins start breaking down the tissue and the fibers. And when they do that, like I said before, the gingiva starts to pull away, it starts to get really red and
Okay.
sore, and then it starts to come down your tooth. And once that bacteria, if it's not agitated or removed frequently, those toxins will then start to invade the bone. And what's really important is with this increase of bleeding and the tissue damage, is that your host cells, are attacking that bacteria, and it's your host cells that are actually destroying the bone.
Okay.
So your host response is actually doing probably more damage trying to get your gums healthy again than the bacteria is actually able to cause.
Gotcha.
So does that sound understandable to you?
Yeah,
Does
I
that make
understand it.
sense? Okay.
How do I change it?
Well, how do you think you should change it? Tell me some things that you might be able to change in your routine.
Uh, use mouth rinse
Hmm.
after I brush. Maybe I should start flossing, but I don't like to. Um, that's just a personal thing though, so probably should start. Otherwise, that's about all I can think of.
Okay. And what is it about flossing that you don't necessarily like?
It's time consuming. It's cumbersome. I don't know. Maybe it's because I don't know how to do it correctly. Never been really shown properly how.
Okay.
So,
Well, so it sounds like you would like to up your oral hygiene care, your home care,
okay.
which is wonderful. And And you're totally correct. You really can start to increase your brushing to possibly 2 times a day.
Okay.
It's really important to brush in the morning because that bacteria that has been building over the night, that really needs to be removed. So it's really important to brush in the morning. And then you don't necessarily have to floss with floss. There's so many other ones out there. We have Perio Aids that's like floss on a handle, quick in and out, so it's not so time consuming. Toothpicks are great. If you'd rather, work your way around with a toothpick, that works as well. So there's definitely other interproximal care as long as that plaque is getting agitated. That is really what we are focused on. As long as you're able to remove that plaque. And to start out with, sometimes, flossing every day isn't going to be great. Maybe it would be better to do 3 times a week and then slowly increase to 1 time a day. What do you think about that? Do you think that would be something that's doable for you?
As long as I remember, yeah.
Well, that's wonderful. So today it sounds like we discussed, your home care habits, things to change, as well as assessments what's actually going on in your mouth.
Okay.
As for treatment planning, oh, we would do something called scaling and root planing. Have you ever heard of that before?
No.
So scaling and root planing is a procedure where we go in with our instruments and we remove subgingivally the irritants that are causing. So whether that be plaque or calculus. Calculus irritates the gums as well as harbors bacteria. It is something that we can use some anesthesia for because we are really going down deep into that pocket. But hopefully with that, we can see some reattachment gain, which is always what we're looking for. So for our treatment plan, you would come in the next time and we would start scaling and root planing those certain areas that have the deepest pocket depths. And then we would keep you on a 3 to 4 month recall. So we'd want to see you every 3 to 4 months and just reevaluate. So it can be a little time consuming, but I think, it would really help overall benefits. Does that sound? How are you feeling about that treatment
doable.
plan?
I think we can do it.
Okay, wonderful. Thanks, Patrick.
Thank
Great
you.
meeting you.
You too.